Barbara, can you hear me?
Barbara's Nick.
I'm sorry.
Oh,
Charlie Sumner, can you hear me? This is Tony Tullio.
Oh, Tony, yes, how are you?
Good, thank you. Just thought I'd pop in this meeting and get the update as to what's happening here in Wellfleet.
Oh, great, Tony, nice to talk to you. I'll see you soon.
Yes, thank you. Good job that you're doing down here in the town. Keep it
Much
up.
appreciated. Oh, I'm having a good time. Thanks, Tony.
Good.
It's nice to hear, Charlie.
Yeah. All right, Hilly, why don't you just go off and start?
So did you just say, would I please start?
Yeah, go ahead.
Okay, sure. So I wanted us to meet. I know we don't have any Title V variances, but I wanted us to consider a mask mandate in town. I've gotten some calls from the public. I have some emails to read into the record. I sent you the nuts and bolts of the mandate along with the packet, which you should have received by email. And then I sent you a more refined version from Truro, which has been through town council, the same town council that we share. Truro's has an addition of some outdoor masking requirements. So I don't know if you've had a chance to look at that.
I did, yes.
Okay,
I
Janet, you
I
did?
haven't, Hillary. I didn't see that one.
Okay, that's okay. We can walk through it. But so we have Provincetown, which applies to indoors only. We have Truro's, which applies to indoors and outdoors. And before we delve too deeply into that, we did get some numbers from the state today on how they calculate their percent positivity. And Wellfleet is at the 5.6% positivity rate. So they're looking at 16 positive cases over the prior 14 weeks, which is higher than the numbers I'm seeing when I run the reports. So they may have access to some cases that I have not seen yet. There may be a couple duplicates in there, but in any case, we are above the 3%. So I think we tried a couple weeks ago to, strongly urge the business community to require masking at their establishments. That clearly didn't go so well because we have cases of COVID in 4 establishments in town that I'm aware of, not all restaurants, just 4 establishments in town. And it seems to be from a lack of masking indoors. So love it or hate it, the mask mandate is here, and I think we should talk about it and see where we want to go. I did give it to Ryan Curley to have a look at. The select board has looked at it. They offered support for it last night. I think a vote of 4-0. Charlie, correct me if I'm wrong, or 4-0-1. I think
One
Mike
abstention.
Devasto- Yeah, Mike Devasto abstained. So I think I could pull one up on the screen to screen share so we can look at it. I'm going to suggest we look at Truro's because it's more
Right.
refined and better put together. So give me a moment while I try to get that onto the screen for us. And in other news, we have passed out hundreds of the Binax rapid tests to the business community as well. I think that's being well received. A couple more went out the door today. Okay. Share screen. Sorry for the delay. There we go. So I'm all for A, B, C. I don't know what we want to do about D and E. Those are the 2 that are questions to me.
Mhm.
I perceive outdoors to be safe from everything we've learned about this virus, but I wonder, there's a piece of me that's slightly concerned about lines of people waiting at places to get in, lines of people waiting to order. I don't know that social distancing is being practiced. And I don't know how realistic it is to think that people are going to stand outdoors in their masks in, 90 degrees in humidity to protect themselves either. So with or without an order. So I'm open to hear your thoughts.
Hillary, one of the places, Ken, through Ken, Hillary, there was no mention of the beaches. And I think that we may have to discuss that, because if you look at Newcomb Hollow, it's extremely crowded, and the people tend to concentrate right in front of the sandbar. And I'm talking mostly I'm worried about the kids more than anything,
Yep.
the under 12s.
Yeah.
And a lot of the visitors want their kids to make friends. And I think there has to be at least some signage down there of what we're thinking about, about social distancing, because I don't see it at the beach. It's very crowded. I don't know if we have to go back to what, the original 10 feet apart kind of thing with the blanket, but I think there's got to at least be some signage down there. And plus there's a food truck there, and all the kids congregate up there.
Yeah.
They're in line, they're waiting for their ice cream, whatever it is, but they're all talking, they're joking. I mean, it's just, I think that we need to do at least a social distancing reminder. Whether we could ever get the kids, as was in our mandate, if you're closer than 6 feet and you're not vaccinated, to put a mask on, I don't know if that would work. I
So
like
that
the
would-
idea.
Yeah, that would fall under D, right? When outdoors
Yeah.
in a public place, including
Right.
streets and sidewalks, if physical distancing cannot be maintained as a result of the number of people. So from what I'm hearing, Nick, you like D, Janet, you like D.
I do.
I like
I
the
think you
idea.
might want to
yeah.
clarify it with,
Yeah.
example, waiting in line or beach.
Yeah.
You know, I think that would
like
be a good,
Okay,
Yeah, I
Because
like
it
that,
sounds so
Janet. Formally mentioning the beach, because it's
Okay.
a very crowded place.
Right.
It's from dusk till dawn. I mean, it's just
Yeah.
very crowded, and it's
Okay.
concentrated in front of the sandbar, and everyone's there. Okay.
well, and I think it's clear if we add including streets, sidewalks,
Walks,
lines, and beaches, if
right.
physical distancing cannot be maintained as a result of the number of people present.
And ponds, all ponds, I guess, would be included in beaches, I guess, but you can mention ponds too, because that is also extremely crowded.
Beaches and ponds. Okay, got it. And then E, Nick, Ken or Gary, any comments, Ken and Gary? Or are
See
you
on the truck.
holding?
Gary, I'll let you go first.
Well, am I on there? I'm sorry.
Yeah, we have you.
Okay, it's extremely discouraging to have to go back to this, to be honest with you, but I don't see really any way around it. I don't see us going against the trend. I don't see that being positive or helpful. So I would have to agree with D,
Okay.
with the caveats about the beaches and the lines.
Mm-hmm.
right.
As much as it pains me to go along with this, it's really
It
inevitable.
does, Gary,
I-
yeah.
Well, I
Um,
think that's a shared sentiment, Gary. No one wanted to do this, but I think this virus is so contagious. And I think we really have to do this. That's just my take.
No, I know. I'm not fighting you, Nick.
I have a
No,
question.
I understand, Gary. I understand, right?
Hillary, is there any way we could gather comparison data from the beach sticker program that kind of lets us know that our population has increased, or it hasn't, by what increase since last summer? I think that information is important to try to obtain, to be able to say, we all feel like Wellfleet is more crowded. We all feel that way, and we don't really, what kind of an assessment do we have really, except maybe the sticker sales?
Well, I can
Give us-
certainly ask Suzanne for that information.
What, do you think it would be
Tomorrow.
interesting?
I think it would be interesting, but I think we also know that and this is what we had talked about in previous meetings, that our population goes from 3,000 to 23,000. So,
Right.
so, I mean, we were dealing with COVID in our year-round population, which increased some this past year. But now we have this massive influx of folks, and we're busier than ever from what I'm hearing from our restaurant teams out there. And there's a lot of people around, a lot of people moving around here. So
Yeah.
I
And the
think
other,
it-
I mean, the fact that there's such,
online.
I think it would be nice to know that our visitors our visitors who come to Wellfleet have increased this summer. I mean, I think that palliate a lot of the, oh my God, we're going back, what's happening, it kind of gives it hopefully a time when it's going to decrease, and we can
Yeah.
reverse this.
And I guess I would say we're not going back forever and ever and ever. We're going
No,
back
no.
until our percent positivity
And see what
decreases
happens.
and our numbers of cases decrease. So,
Right.
I
Okay,
mean, we've
here-
got
here-
school starting up soon. Our children aren't vaccinated. I just, I'm getting worried day by day. I had about a 2-week reprieve from COVID, and that's when we had mosquitoes, and now we're right back in the
Right,
thick of
right.
COVID. So,
I think,
Oh,
you know, when
lose
it,
my mind, folks. I'm gonna lose my mind. But okay, so Ken, can we hear from you?
Yeah, Hilly, how many cases of COVID do we have in this town right now?
How many cases of COVID do we have in
Yeah,
town right now?
I've seen different where they're under 5.
No.
no,
I've
5.6.
seen different things where, right now on this other site, in Barnstable County, there are 39 new cases. And no
That's
deaths.
39 new cases today, but the thing that gets
Okay.
tricky in case counting is, you could get 2 new cases today and 3 drop off. Then
Yeah.
tomorrow you could get 4 new cases and 1 drops
Yeah.
off. So
The only thing I can say, I don't like panicking for anything. You know what I mean? I can probably D is very questionable for me. I don't mind the signs at the beaches. E I would be against. Well, C's fine, that's already there. That's a Massachusetts thing. You can't get around that. The massage parlors, hair salons, yeah, I can understand that, but I don't know why. I understand we're following some types of guidelines, but I'm just nervous that, we're like, the sky is falling again, where the hen scared about anything, I know, and I don't see where the increase in cases and deaths has just gone astronomical where I would be all on board as well, but right now I'm not. We have like 3 more weeks of the summer, and then we'll lose at least half the population. So I'm just worried that we are just going too far right this moment. And Truro is Truro, and P-Town, they have their own congestion. Wellfleet would not as congested as P-Town and North Truro. And I'm not agreeing with everything, but yeah, I know the board is going to be, the consensus will be to go forward, but just let you know my opinion on this.
Hillary, if I could add through Ken, I think one issue I always have trouble dealing with is that every week there's about new people come into town. I mean, we have no idea where they're coming from. We have no idea if they're vaccinated. There are parts of the country that aren't very well vaccinated. So it's just the unknown of who's actually coming into town that we have no data on that. So I think we have to be very cautious. And I think I understand it should be limited to a few more weeks, we hope, but I think with our rate at 5.6%, I think we follow that. I mean, I don't know if there's much testing going on around town, or if we're getting people still getting vaccinated, but I just think there are too many unknowns and this is too dangerous.
So, our percent positivity rate comes from the 16 cases that the state has identified and 286 people they have record of as being tested
Right.
in Wellfleet in the past
Right.
2 weeks. Now, that number does not account for the rapid tests that we pass out unless they're positive. So that doesn't take into account negatives, but I mean, we're
Right,
seeing,
right.
we're seeing cases and we're seeing transmission in our establishments, and
Right.
it just makes me a little nervous.
Hilly, can I ask a question about the contact tracing? But even this, I mean, if a worker in town gets positive, it becomes positive, but they live in another town,
Yep.
where does that get reported?
So that gets reported into Maven, which is our online disease reporting system. And because most of the town, all of the towns on Cape Cod except Provincetown contract with the Visiting Nurses Association of Cape Cod Healthcare to do their contact tracing.
Right.
They will report back to us that we have a positive case at such and such establishment.
Okay, so we
we're
will get
aware of that.
Okay, very good. Okay.
And they don't get attributed as a Wellfleet case. They would get attributed as an Eastham case or a Truro case. But Provincetown contracts with Barnstable County, their nursing division. So we hear about cases there too that live in town. So there's really good contact tracing, and that's, you know, really an effective part of this.
But as far as they're getting reported in another town, that's because I know of 2 people who work here who were positive. They live in Eastham. So I'm
Yeah, they
wondering,
don't count into our numbers.
so they don't count. So there may be other things going on in town that we don't know about.
Exactly.
Exactly. So that's another reason I get nervous about this, about it being, it's, okay.
So I
right.
heard a yes out of 3
what
or
else
4
is
of you
there?
for D. Do we want to have a look at E? Ken, I heard say no to E. E is whenever outdoors on the premises of public or private property in use for the purpose of a gathering, which includes without limitation community, civic, public, leisure, faith-based or sporting events, concerts, conferences, conventions, fundraisers, parades, fairs, festivals, weddings, funerals, and any similar event or activity that brings together more than 100 people in any space. So my guess is that would apply.
I'm not thrilled on that.
You're not thrilled on that.
I'm not thrilled on E. That's, you know, at least the private property part. You know?
Right, because that would be like a wedding. Well, no, a wedding on a.
That's in outdoors, yeah, in outdoors.
I understand that you're going for like that backyard wedding thing. I understand. I understand that. It's just, is there any way we can take out private property and substitute of public or
We could just have public property.
Yeah, but that's gonna
Yeah,
leave a
no.
hole in this mandate.
Yeah, exactly.
Yeah.
I mean, just for the record, I'm in favor of E, so.
Yeah.
I
We have
think
no,
it
once
needs-
again, we have no idea who goes to these functions.
Well,
mean-
and I guess I'm sort of thinking E, I'm thinking Oyster Fest, I'm thinking the parade, I'm thinking, you know, I don't know, other bigger things like that, where we're gonna attract people.
Yeah. Yeah, I guess we can't stop E. I'm not. Yeah, I understand.
And, you know, who knows, maybe come the beginning of September, maybe we have 0 cases. I mean,
Exactly.
we have to
Right.
be committed to reevaluating, you know, pretty regularly
Right.
with what we're doing. So we're in line with what's going on in the community. So it's not,
Right.
we don't pass the mask mandate and then walk
Right.
away till December and say, oh gee, what do you guys want to do? Like, we have to be
Yeah.
committed to looking at this, you know, every 2 weeks as
I
numbers.
mean,
come and
I would
go.
take the approach that as of right now, we need this, as of now. What, 2 weeks from now, 3 weeks from now, maybe
We don't
different.
know. We
That's
just
the way
don't
this whole
know.
pandemic has been. Things have been changing from month to month, week to week.
Yeah.
I mean, it's just, we have to wait and see how it goes.
Exactly.
Yeah. Yeah, I understand. No, I get it. I get it. I get it.
I mean, I don't think any of us are happy that we're in this position.
No.
I mean, I couldn't be any angrier, actually. Like, I don't
Yeah,
want to be
yeah.
getting calls from the public that, you know, Joe is out doing this and not wearing his mask, or get a call that, oh, I saw a bunch of people at, X restaurant that are not wearing their mask. Like, it's not fun for any of us. And like I said, I'm nearing the end of the line here. Like, I'm gonna lose it soon.
No,
So it's not with excitement that we bring this before us.
No, I know, I understand that, and I'm not suggesting that it's a gleeful thing for people. No, I'm not suggesting that. It's just I'm kind of in the part of me agrees with Ken. It's just that there's just a couple of, we're in the home stretch, and then most of these people will be gone anyway.
Yeah.
And we can evaluate it after that, and then we can reevaluate it.
Right. I guess if we can
be
somehow, well, can we then get together as a board? Then can we, in this quote unquote emergency time, can we then make a appointment for 2 weeks for us
2
to
weeks.
discuss this?
Right.
Excellent.
If you're going to do something like that, you gotta do it on a weekly basis. In 2 weeks, the summer's over. Right now.
Well, then let's do it on a week.
Yeah,
I'm
if-
with you, Ken. I'm
if-
with you.
if-
Let's do it next Wednesday.
Yeah, if he goes into, if you want to do E, which I'm gonna be against anyway, I'm going to be. E goes in effect, all the parks, all the recreation down on Mayo Beach is gone. All that information where the kids are going. That's they're not gonna wear masks. It's gonna be done. I drove by there the other day with my wife. They had a band there. Gary, you played down there. That's gonna
Yeah, we
be
sure did.
be done. And I don't like, you agree, Hillary, the temperature's gonna be climbing. Right now, I work outside a lot, and the idea in Orleans, I don't know what they're gonna be doing, but the idea of working outside with a mask on scares the crap out of me because it's gonna be too hot all the way around.
So don't lose sight of in D where it says whenever outdoors in a public place, including streets, sidewalks, beaches, ponds, whatever we're gonna add to it, if physical distancing
distancing.
cannot be maintained.
That's what I'm saying. Yeah. Right.
Like, so you still have the option to physical distance, but if you can't physical distance, then you should wear
Right.
your mask.
Right.
Well, that's why at the Pearl on Friday, everybody's gonna be 6 feet plus from the band, I'll tell you.
Good.
Great, that would be excellent.
They'll still hear you. Yeah,
I don't have to worry about that, Ken.
they'll hear you, Gary. Exactly. They'll still be dancing. Maybe.
All right, so what else we have to do, Hillary?
Well, do we just wanna, roll through the rest of this, just so we're all
Yes.
familiar?
Yes, we should.
So 4 is like, 4 kind of is a question mark to me because it kind of negates D and E.
So the order shall not apply to informal gatherings at private residences in which no compensation for the use of the property is paid to the owner, and it shall not apply to unorganized gatherings in unenclosed. So that would mean, like, if you're at the park, if you're at Baker's
Right.
Field,
Right.
and there are 100 of you there just by happenstance, and you're not a gathering, and you can maintain your 6 feet, then you don't need your mask on.
I agree with that.
Okay. Yeah.
And it doesn't say the 6 feet in that 4.
Yeah, exactly. I was going to mention that.
So we can add
That's so
that.
critical in a lot of these mandates. You got to add it,
Yeah.
right?
And I do think we should not put the, what do we want to do with the beach there in number 4? Do we want to keep that in or just leave it in our number, in our other one that we put it in? In D.
Yeah, beach, we go into D, right?
Yeah.
I thought that's where we put it, yeah.
Yeah.
So get rid of beach in 4.
Yeah,
'Cause we
because
have
it's
it-
now in D.
Yeah.
It's
'cause
in
we're
D.
gonna
And no,
D.
it'd be redundant. Yeah.
Yeah,
All right.
And maybe after parking lot, put a comma. When appropriate
distancing,
distancing.
yeah.
When
yeah, I
distancing,
got that.
comma.
Yeah, I got that. Okay, so then, number 5, the face covering requirements of this order shall be in place until it is rescinded by the Board of Health.
Right,
That's
agree.
good.
That's good.
Okay, full vaccination against COVID-19 remains important to reduce hospitalization and morbidity from the virus. We encourage all eligible persons who are not fully vaccinated to get immunized. We have immunization opportunities in Provincetown until August 21st and at the county every week. So we have options. It
Okay.
is recommended that all non-vaccinated individuals wear a mask in all public areas.
Okay.
Number 7, notwithstanding
I
any
like that.
provision in this order pursuant to guidance issued by CDC, face covering should not be placed on young children under 2 years old, anyone who has trouble breathing, anyone who is unconscious, incapacitated, or otherwise unable to remove a mask without assistance, or anyone who, due to disability, is unable to wear a mask.
Okay. Agree.
That's good.
Number
That's good.
8, to the extent necessary, this order shall be enforced by, we're going to change Truro to Wellfleet, health
Yep.
agent, assistant health agent. I'm not sure if Wellfleet Police Department is going to participate in enforcement, so that's a question as of right now.
Okay,
Chief was worried about it because it's been so difficult in the past, and
Yeah.
you know, I'm hoping we just achieve compliance. But that's a big hope. So,
so
I'll
we,
have
we
to-
don't know if we'll add that yet, right? So that's an
Um,
unknown.
well, we're gonna leave the health agent and the assistant health agent.
Okay,
It's unknown whether chief will want to participate in enforcement. So,
Well, shouldn't we know that before we approve this?
well, I'm gonna not put it in unless he's willing to
That's fine.
participate. Yeah. I mean, we have to make a couple small revisions anyway, so. Okay, then we have whoever violates the provision of the order can be penalized by a non-criminal citation. That's the same process we have for all of our Board of Health regulations. And then it lays out the fine or fee structure.
Hillary, can I ask a question about, this goes back way back, but at one point you were thinking about getting us some kind of an ID as members of the Board of Health. Remember
Yes,
that?
yes,
Because
and
Right.
the
I know,
conservation is
I figured
asking.
it'd bring a
you-
chuckle back, but. right.
No, am I hearing that you want to go out and be an enforcement arm of this? 'Cause
Well,
I would-
there may be something so egregious. I'm at that beach all the time and it's
Okay.
a madhouse, but
yeah,
maybe I put my neck on the block and, mention to someone, maybe 6 feet, the virus is still, evident. No, I mean, I would like to be identified if I do that. That's all I'm saying.
Yeah, no, and I
Gives me
think
the,
I
gives me
would
the
say
option. Gives me the option.
it's kind of a harsh world, Nick. And people get really angry and they yell at you. So I'm not sure
no.
you actually
I
want.
understand that.
Yeah,
I have my henchmen at the beach too, so. No,
yeah,
but
yeah.
no, I haven't weighed Hillary. I talked to people for 35 years about all sorts of stuff.
Yeah,
So
yeah. I mean,
it would be very, well, I would just like an ID. And I may not even use it, but if you can get
Yes,
something
yes.
like that.
I'm happy to reach back out to Chief Polly
Yeah.
and see if we can get
Yeah.
that.
I mean,
get that
even
moved.
for our site visits, I thought it was right, John?
Yeah.
I mean, I think that was
Right.
very reasonable. It's nice to be able to
Can I
identify.
get a
yourself.
badge?
Or
Yeah,
they
I-
have something.
Mine. I'll give you mine if you use it.
yeah. So you'll find out about that for
In
all of
fact,
us.
maybe you can give me, you know what, Hillary would be good? Maybe you can give me an ID without a picture on it, but it has Gary's name. Something like that. Something like-
Okay, I'm
Right.
all in
See what you
favor.
can do. Be creative here. Right.
Yeah, listen, I'm on board. And then an effective date. And I think before we vote on this, we should hear from the public and hear the correspondence that I took in.
Okay,
But an effective date.
ASAP, probably.
Okay.
Saturday,
Oh, yeah.
Friday,
Saturday.
Saturday?
No,
I think
Sunday.
Friday.
Are you-
We gotta
Katie,
go
you plan-
Friday.
Are you playing Friday? Is that?
Yes.
Sorry. I
Yeah.
think Friday, tomorrow we'll redraft it, get a press release together and ship it back out to the business community.
okay,
good.
good.
Okay, I'm gonna look to the public in 1 second. I just have one more note to take. Friday is August 13th. Okay,
Friday, the 13th.
perfect. Just what I like.
Yeah.
All right, let's see who we got. Any questions from the public before we go to the correspondence in my email? I see Claudia, Mary Beth. Anybody have anything to say? Jan Morrissey, Terry? Claudia, let's take you first. Those of
Hi,
you who don't
everybody.
know Claudia, she is our school nurse at the elementary school, and Claudia and I work very closely together throughout the year on these issues and others. So go ahead, Claudia.
Thanks for the introduction, Hillary. Can everybody hear me okay?
Yes.
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 Okay.
Yes.
I might be jumping the gun, but my concerns are going to be for September when we come back to school and we have to make decisions about whether kids are going to be masked, unmasked, whether there's going to be masking of teachers regardless of vaccination status, and are we talking at all about any kind of a requirement for teachers to be vaccinated in the school system? I think for this particular moment, what you're talking about might affect the rec department. I do feel as though outdoors is a fairly safe way to be. We've shown in schools that 3 feet is a reasonable distance, and that outdoors at 3 feet seems perfectly safe based on the experiences that we've had over the past, year with COVID. So I'm just wanting to put some, a bee in your bonnet for what schools will look like in September. And I do support masking in public spaces at this time. I think it's happening very unevenly right now. And we can get ahead of the game if we ask people to mask. Again, it's a small sacrifice for the greater good. Thank you.
Right. Okay. Thank you, Claudia.
Thank you, Claudia.
Anyone else? Okay, then I'll move to my email and read some correspondence that I've taken in over the past, last week and this week. So this one comes from a Christy, and she writes, "Dear Hillary, I am writing to express my support for a mask mandate in Wellfleet. Provincetown and Truro have now established them, and I believe it is critical that we do as well. We know from experience that masks make a difference, and we also know that there are unvaccinated people taking advantage of the honor system. I think a mask mandate will have minimal effect on the economic success of our businesses and will have a hugely positive impact on a safe and smooth beginning to the school year. Without a mandate, you are leaving the work of protecting our community, our servers, our kids who are out there working in big numbers this summer to a few managers. Some are taking on the responsibility with great commitment, and others are denying the critical nature of the rate that COVID cases can spread. Please think of the complex nature of the economy, which includes successfully sending our kids to school in September, and take swift action with this simple and effective measure. Thank you, Christy." The next email comes from a Colin, and he writes, "Wellfleet mask mandate soon, please." And he clips on the Truro press release. Then I have had a conversation with Bridget, and she sends this email. "Please make sure public-facing employees are vaccinated. And if you are unwilling to do so, then at a minimum, mandate that the unvaccinated employees wear masks at all times, inside or outside. I was shocked to learn that a person working with the rec department was hosting pickleball, where there are many older people in close proximity in the open air courts. I sat beside him on and off for about an hour when he mentioned he didn't believe the news about vaccines. And when I asked him if he was vaccinated, he said he wasn't. I was shoulder to shoulder with him sitting on a bench and came home concerned that I might now be carrying COVID with me and infecting others. The person also said he works with children. With the current information about the variant, Wellfleet needs to step up its game and do more to ensure employees are putting the safety of the public first. I did tell the manager about it, but wanted to follow up because with schools opening soon, we need to protect the community from viral spread. Warmest regards. Then we have one from Eric, and Eric writes, this one's lengthy, so bear with me here. Hello, Hillary. The Board of Health's August 5th mask mandate draft was brought to my attention today. I was puzzled and dismayed that such a policy might be considered. No reliable study has ever demonstrated any significant reduction in viral transmission from mask wearing, and many studies performed over the course of decades have shown that masks do not work in this capacity. Moreover, the threat from COVID, which was mostly to the elderly, unwell, and a couple of other clearly defined groups, has long been over, despite media hype of cases being fueled by the continued presence of a completely inappropriate PCR testing regime. I realize that local health authorities have been put in a difficult and unfair position due to rampant misinformation put out by incompetent or corrupt state and federal officials and abetted by irresponsible fear-mongering on the part of the media. Nevertheless, I strongly urge you and any other involved town officials to inform yourselves of the facts before implementing such a useless and disruptive measure as a mask mandate in Wellfleet. Such a move would only add to the confusion and uneasiness of the general public, who have unfortunately relied on compromised corporate media and conflicting or false statements from federal and state authorities concerning a viral outbreak that for the vast majority of them poses no danger. As I'm sure you know, the sensationalization of the reported outbreak of cases linked to Provincetown has dealt a serious blow to summer business there. Below, I have listed just a few of the many well-documented sources of information available to dispel the misconception that a mask can inhibit the movement of an aerosol virus particle. Please feel free to contact me and to share this information with anyone you think might benefit from it. Regards, Eric. P.S. Please note that I am well acquainted with the official narrative and statistics on COVID-19, so there is no need to supply me with anecdotes from them. Also, please keep in mind that having worked for both federal and state agencies, I am quite familiar with how the incompetent and corrupt can rise to positions of influence within them. Info on masks as intervention against viral transmission. And then he cites emerging infectious disease policy review, non-pharmaceutical measures for pandemic influenza in non-healthcare settings, personal protective and environmental measures. That's a CDC article. The New England Journal of Medicine perspective article, Universal Masking in Hospitals in the COVID-19 Era. He cites BMJ publication, a cluster randomized trial of cloth masks compared with medical masks in healthcare workers. He cites Oral Health Magazine article from 2016 by oral surgeon, Why Face Masks Don't Work, a revealing review of their inadequacies. 2020 Oral Health article by the same surgeon, The Peculiar Reality of COVID-19, scientific review of medical literature on the efficacy of masks, Masks Don't Work, a review of science relevant to COVID-19 social policy. A technical article by pharma biotech PPE expert, The Year of Disguises. Despite a couple helpful political comments, his technical knowledge is clear. Long, two-part C2C journal piece, Reevaluating Mask Mandates. Reevaluating Mask Mandates Part 1, Science Gives Way to the Talisman. Reevaluating Mask Mandates Part 2, Exposing the Assumption-Led Claim. And then a short piece by NHS clinical psychologist Gary Sidley. Then an article with a fair amount of commentary and charts, but also an explanation of why mask mandates had no effect on cases or mortality. These 12 graphs show mask mandates did nothing to stop COVID. Just gonna flip back here and see another comment. Went to play pickleball. This is from someone else. Went to play pickleball and saw the no vaccine guy at a picnic table filled with small children teaching art. No masks, pretty crowded together. Yes, there's wind, fingers crossed. Another comment from Eric. I told him I would share his correspondence and he writes, thanks, Hillary. I very much appreciate it. attaching it here as a PDF in case that makes it easier to share. The hyperlinks in the PDF should work, also including this website put together by a highly motivated professional who is a mother of school children in Newton in collaboration with other moms. This is the page linking to letters they make available for parents to send to school admins. Hers is the first one and includes a lot of well-researched, scientifically sourced information. The second is from a public health professor and includes a good graphic explaining how tiny a virus particle is. The third is from another mom working with her school system to bring the kids' worlds back to normal. And I just want to make sure I don't have anything else lurking here. So give me 1 minute. Okay, that looks like all I have. I then took in about 3 or 4 phone calls from folks as well, requesting a mask mandate. So that's all
Can
I
I
have.
ask, Hillary, can I ask you about what the school nurse was saying about 3 feet as opposed to 6 feet?
Yeah, so DESE, which is the Department of Early and Secondary Education, had relaxed the 6-foot distancing to 3-foot distancing in schools. They found that the 3 feet was just as effective as the 6 feet in an educational school setting.
I got you. We would, but that's different than eating and drinking, right? Establishments, you think?
You know, I don't have a solid answer on that.
Yeah.
Claudia may.
Hillary, was that before Delta took over?
That was previous to Delta,
Yeah,
yes.
exactly. I mean, this is a whole new ballgame.
There's
I
the
think, with
difference.
Delta variant. I mean, it spreads in 2 or 3 days.
Can
The
we hear
amount
from
of virus
Claudia?
spreading is threefold what it used to be. So I think
Yeah.
that's a whole new ballgame. It has to be reevaluated as far as 3 feet with the Delta variant.
The 3 feet was an attempt by the Department of Elementary and Secondary Education to fit kids into the school building. So we just, as you can imagine, schools are not designed to space kids out at 6 feet. And so kids are at lower risk of contracting. And that was 3 feet was with a mask on. They encouraged, actually it was a mandate, if you were unmasked and eating lunch, it had to be at 6 feet. And we await any kind of guidance from DESE for September because we are lacking that. So the 3 feet was with masks, 6 feet without masks.
Thank you. Thank you for
Okay.
clarifying that. I thank you.
Very good.
welcome.
Thank you. Thank you, Clara.
Hillary, has there been any talk or any exploration of doing anything about identifying unvaccinated folks in an official capacity? Nobody wants to touch that. Yeah.
You
Okay.
can't touch that.
I just thought I'd
I think,
I'd ask the question.
yeah, no, but I think we're seeing that in New York, right? They're having your vaccine passport. You can't go into certain restaurants without being vaccinated. Provincetown has a 3-pronged approach where they advertise, all of their staff are vaccinated or most of their staff are vaccinated. And I think they are requiring proof of vaccine into their establishments for Carnival Week. And I think that's ongoing now as well. So
That was the question. I didn't know if anybody was touching it. I didn't know if
yeah,
anybody.
no,
was
people
touching
are. People are.
No.
I'm not
People
ready,
are, okay.
but people are, yeah.
I think
Okay.
recently, Mass General, the Partners Healthcare System, which I think is the largest employer in the state, maybe 80,000 employees, has a vaccine mandate now. So the private sector is stepping up, I think, with mandates on vaccines. So that was a big move on the partners' part. But I think they're mandating vaccines in the healthcare system.
We'll see how the court system handles it. That's gonna be a lawsuit waiting to happen, so. Okay, well, Hillary, do you have anybody else?
That's all that I have. Allison, I noticed that your hand was up early. Do you still wish to speak with us or are you okay?
Hey there. Well, I guess my question was answered, kind of. So we had a tough time at the Pearl, just trying to get folks to follow the rules. You know what I mean? Especially what was hard in a restaurant setting isn't, people walking in with their mask, that's cool. Taking them to their table, that's fine. Then they take it off and then they're enjoying themselves. And then if they get up and go to the restroom or run out to the car or whatever it is, it was like my staff constantly chasing around people. You got to wear your mask. Oh yeah, yeah, yeah. And then they put it on and they, whatever. But last year was it was organized because it was a lot scarier. No one was vaccinated yet. It was, everything was really spread out, and the masks made a lot of sense because it was in addition to. Now with I mean, I don't know about everybody else, but I can tell you that it's so busy. There are so many people, and masking makes complete sense. And it's awesome that you guys are going forward with this, because then it's not well, you should wear it. You're going to wear it because it's a mandate, and that makes our lives so much easier. But as far as enforcing it, I feel like we're going to get a lot of pushback, and I just don't know if there's who's is there a way that you can kind of help us out as far as I saw the signs that you guys had sent out. I didn't know if you were going to update them to say the mandates so you can send them out to the businesses so we can post them everywhere. That would be one question I had, definitely getting something like that down there. And then who else in the community helps us to kind of get the ball rolling? Hey, this is a real thing. This is not a suggestion. This has to happen. You know what I mean?
Good question.
Hillary, what about support from the chamber?
What about the chamber? Well, I don't think the chamber is going to go to every restaurant and, walk them through enforcement of the public. I think that's unreasonable.
Well, some kind of statement. I mean, something.
Yeah, no, the chamber, we work very closely with Lara. We're in very close contact. She actually sent this around to all the businesses today, so that they knew we were talking about it, to see if anybody had any additional comments. So, I mean, we can work with the chamber to get a sign out, but I think it's going to take a little more than a sign. It's going to take, someone rolls up to your
No, I understand. Yeah.
and you have your host or your hostess. And I think, that person can say, please wear your mask. We have a mask mandate here in town. You can take it off once you get to your table, but you need to wear it in the common areas. And then, people are going to choose to either be belligerent or they're going to choose to accept it. I mean, you may lose some business over it if folks just can't comply, but it's going to be the same all over town. So I guess I don't feel, from what I'm hearing in Provincetown, people are not being belligerent. They're wearing their masks. Same in Truro. I queried Emily this morning and this afternoon. Tell me, how's this working in Truro? And she said, it's just not an issue. Everybody knows they have to wear it. The businesses tell them and they wear it. I mean, I don't expect anybody to get into fisticuffs about it. And if you have someone who's particularly unruly, then off they go to their table and they'll be the odd man out, I'm thinking. I could be wrong. I could be way off base. I just,
Yeah. Well, I think what happened I think what happened go ahead, I'm sorry to interrupt. What happened in Provincetown was, I think, frightening for a lot of people. Does the public know that we have 5.6% positivity right now? I mean, something that would get them thinking that, well, it's COVID in town. Is that a bad thing? Or, I don't know. Maybe they're just not taking it as seriously.
I did report at the select board meeting that we've had 20 cases over the past month. And, that's more than we've ever had here in town. So it does scare me. I mean, we have a lot of people here.
Exactly, right.
Well, Hillary, what's the next step? Somebody want to make a motion for this with your edits? Did you hear me? Somebody want to make a motion with your edits on this?
Does somebody want to make a motion is what Ken is asking.
I move that we accept the mask mandate as of Friday, the 13th of August, as discussed and documented at the Board of Health meeting by the Board of Health until further notice.
And all in favor?
You need a
I need a
second.
second.
Aye.
A
No,
second.
need
Oh,
I'm
second.
sorry. Need a second?
Nichols second.
All in favor?
Aye.
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 Three opposed, so 3-1.
And I do see that Suzanne just joined us. So Suzanne, can we ask you a quick question? Not to put you on the spot, but we're wondering if you've seen evidence of more people in town this summer versus last summer by way of beach sticker sales. Do you have a way to sort of ascertain that information with what you have software wise, or is there a way?
There is a way of doing it. Off the top of my head, anecdotally, I think we've sold more stickers, but I will get those figures to you.
Good.
Excellent.
Tomorrow.
Thank you. Thank you. Thank you,
You're welcome.
Suzanne.
Okay,
Thank
so-
you.
All right, well, so Hillary, what next do you have? Do you have anything else you'd like to talk about?
No, I think I'm done talking about COVID. We could talk about mosquitoes if you want to talk about mosquitoes, or we could talk about the 2 doodle polls I sent out to you today. Actually, I think you Board of Health only got 1. I did send out a doodle poll for our meeting with the wastewater committee on the Board of Health and the Conservation Commission, DEP, and Barnstable County Septic Test Center folks. So check your email for that. I tried to keep it targeted, I think, to 2-day, choice of 2 days.
Yeah, I saw that.
Only because if I go any wider, I'm never going to be able to collate something for all these people.
Right.
So I'm hopeful. I think it's like the 3rd week out in September that I was looking at, which is still kind of far away. So I'm hoping your calendars aren't booked up. I think there's day times and night times. So, you know,
It's a nice variety. Yeah.
have
it's
a
nice.
look, find what works best, and get that back to me so we can firm something up. The other thing I'm working on with Scott is to put in a 1/3 of the fall tax insert. So I just want to pull this up and show you what it looks like. So bear with me here. It would be a 1/3 of the page on the information, and this is only a draft of what it looks like, but I want to share it with you. Share screen. Okay, it looks like it's still thinking.
Did you send that to me, Hillary?
The doodle poll,
Yeah.
yes.
Okay. Because I didn't see it.
I just answered it.
Okay, good. So here's the graphic. Share. And this is obviously more than a 1/3 of a page. So the thought is that we would edit out the house and maybe just leave the toilet to the septic tank, to the aeration chamber, to the wood chip chamber, to the leach field. And then this is the text that we would look at. I think it's benign, but I want you guys to have a look at it. This obviously isn't tied to any regulation because we don't have one yet.
That looks fine, Hillary, to me.
Yeah, I think it's fine, Hillary.
Is there any way we could put in there that it's provisionally?
Yeah, absolutely. The systems are provisionally approved or, yep,
Right.
And
Just-
require at so much testing per year.
yeah. I figured I would give people that info when they called me, but it's just as easy to put it out there and then maybe they won't call if they're not interested.
Yeah, right.
Because isn't provisional like 4 times a year,
Yeah,
Hillary?
exactly. Yeah,
That's a lot of
Okay.
testing.
it's a lot of testing for sure. So we have that. We have the joint meeting that we have scheduled. And I'm just trying.
And then there's gonna be a meeting with the Conservation Commission? Is
Yeah,
that-
so you should have the doodle poll. That's what I sent out. It's a meeting of the wastewater committee, the Board of Health, and the Conservation Commission. And coming to present would be Brian Dudley from Mass DEP and Brian Baumgartel. And I'm hopeful that we can discuss at that meeting regulations and where folks want to go, what seems reasonable from a state, county, town perspective. And then also hear from the state and county how these systems are functioning, what the results are looking like, what the data is looking like, what the numbers look like, and understand from Brian where they are in the permitting process, when they will move from provisional to general, how many systems are in the ground. So I guess I expect it to be sort of an educational opportunity for all of us to just learn and figure out how we want to move forward as a team
Sounds
rather
great.
than
Sounds
independently,
great.
because if we all hear the same information at the same time, we're just better off. I did invite Andrew Gottlieb as well, just because he has been so immensely helpful to me over the years in sort of wading through this, and so I did invite him also.
Good, good. Sounds good.
I think that's all I got.
Okay, anybody else have any questions, concerns?
Do we want to schedule a meeting then for a week, or do we want to schedule?
Yeah,
a
next
meeting
week.
in 2 weeks?
Next Wednesday?
Yeah, we should do next Wednesday at 5:30.
That
Is
would
that
be,
good with you, Hillary?
is that the 25th? I don't even know what day it is. No, that's not the
Today's the
25th.
11th.
Yeah, is that the 25th?
No, the
No, it's
18th.
would be the 18th, I think.
7th.
Yes, it's the 18th. My paper calendar had a page stuck together. That's fine.
It'll be short meeting. It's not like it's going to be a big, long meeting. It's just an update on the testing.
Yeah, that's fine.
Right. Okay,
All right.
sounds good.
Okay.
I'll
then
put it in
we'll-
my calendar.
All right, we'll meet
Beautiful.
Next Wednesday at 5:30 to discuss whether we're gonna keep the restrictions implemented or drop them.
Yep.
Okay, so, can I have a motion to adjourn if that's it?
Did we have meeting minutes or anything? I'm just pulling up the agenda so I can see what
We
Rebecca.
have minutes.
Oh,
Okay,
Minutes I'm fine with.
So am I.
Yep.
So who make a motion to approve all the minutes that you have? Could I have a second?
I'll make a motion to move that we approve the minutes.
All right. All in favor?
Aye.
Aye. Barbara? Nick?
Nick is muted.
I would think Nick would approve them as well. Well, go wait, here you go.
Can you hear me now?
Got
Yep.
you now.
Okay, that's a yes. Okay.
Okay. 4-0. All right, so we all set?
All set.
I think so.
All right, let's talk to everybody next Wednesday.
Thank
Oh,
you.
see you next Wednesday,
Wednesday.
guys.
All right,
Get your
Bye.
armor
Thank you,
out.
Gary.
bye.
Thanks for
Hillary,
all
can
your
I
help,
ask you
Hillary.
one question before you go? Hill, I need to ask you one question before you
Yes.
go.
Yes.
We're having a board meeting of 246 on
Yes.
Thursday. And I'm just so hesitant to make any plans at all. First of all, the hood is being put in the kitchen, so the
Yep.
kitchen's kind of out of commission. But I'm so, the process that we use, how it's open window and
Yep.
blah, 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 blah. So I think what I'm gonna have the board think about is the takeout process again.
I was gonna say, if we could continue with the takeout model, I mean, you're serving sensitive populations and all different ages mixed, and it's popular. I think plan for the takeout, and if our cases
Okay.
are at 0, then we move models again. So
Yes,
I
okay,
think we have
okay.
to be reasonable and flexible, and I think we build 2 models and we can oscillate
Right.
back and forth.
The
between them.
most wonderful part about it is we have the contact information of the 60 families,
Yes,
and
which
we
is
may
awesome.
want to expand it to working moms.
Yes, please.
That would be nice. Okay?
Because just FYI, I came home from the office. I
Yes,
came home from the office and I got a juicer for my birthday, and I'm in the door 5 seconds and my kids are like, can you make us juice? Can you make us juice? And I'm shuffling to make fresh juice while getting on the meeting. So yeah,
that's great,
working moms
that's great.
need help.
Because the incubation
Working moms
period
need
is
help.
Okay, hon, thank you.
Well, I think it should
Okay,
be
good
more
night,
than that.
everybody.
Good night.
No, I'm just saying, is a week enough